The latest of the pandemics, the Zika virus disease, has taken the world by a storm. Zika virus disease, caused by the Zika virus, was discovered in 1947. The first human cases of this illness were detected in 1952. Prior to 2015, outbreaks of Zika have been reported in tropical Africa, Southeast Asia, and the Pacific Islands. More recently, there has been reported active transmission of Zika in South and Central America, as well as numerous reported cases in the United States and Australia. In comparison to other diseases, such as Ebola or AIDS, Zika is not that catastrophic. Common symptoms include fever, rash, joint pain, and conjunctivitis, or red eyes. The illness is pretty mild, and these symptoms don't usually last for longer than 1 week. People usually don't get sick enough to go to the hospital, and they very rarely die of Zika. In fact, at times, people do not even realize that they have been infected, and once a person has been infected, that person is protected from all future infections. Zika is primarily spread from one person to another through the bite of an infected mosquito. The virus also spreads through blood transfusion and sexual transmission. Surprisingly, the Zika virus is able to thrive in semen longer than it is able to thrive in blood. Zika also transfers to a fetus if a pregnant woman has been infected. The virus doesn't sound so bad, so what is the big deal? Well, infection during pregnancy can cause a number of major birth abnormalities, including a serious birth defect called microcephaly. Microcephaly is a neurological condition when a baby's head is much smaller than expected. It is caused when the brain does not properly develop. In the case of Zika, the virus infects and destroys parts of the brain, resulting in this condition. Since symptoms of Zika are often mild, the patient does not realize that he or she is a victim of the disease. Because Zika is present in semen for up to 1 year after the individual is infected, any infected man can unknowingly infect a pregnant woman, or even impregnate a woman when he has Zika. This endangers the fetus and makes it vulnerable to numerous birth defects, so unborn babies across the world are in danger of having severe, possibly fatal, birth defects. There are several ways to prevent such situations from happening. Number 1. All pregnant women should remain abstinent for the duration of their pregnancy. Number 2. Doctors should develop a medical test to detect Zika within semen. All men should take this test at least once a month. Number 3. When having sex, a condom should be used 100% of the time. Note that this may decrease the chance of transmission, but does not eliminate the possibility entirely. Number 4. Doctors should develop a medical test to detect whether or not pregnant women are carriers of the Zika virus. Number 5. Everyone should take preventative measures to avoid mosquito bites. There are a number of ways to prevent mosquito bites, such as wearing long sleeves and long pants, using insect repellent and reapplying when necessary, and using a mosquito net as protection when sleeping. Individuals who have recently traveled and are unsure of whether or not they have been infected by the virus should also take these precautions, because if an infected individual gets bitten by a mosquito, then the mosquito is now infected and capable of spreading the disease, which is how the whole cycle begins in the first place. So, that's all for now, folks. Try not to get infected, and thank you for watching.